I'd now like to invite Steve Slack, the Director of the Centre for HIV and Sexual Health, to come and speak to you. The Centre has part-funded the event tonight and continues to play a key role in sexual health promotion in the city. Steve has a background in child protection and mental health social work, which continues to inform his work in sexual health.
Tonight's vigil is in part an opportunity for remembrance, reflection and contemplation, and we will be requesting a minute's silence for people to reflect on people that they may have lost, or to think about people living with HIV, or to ponder on their own experiences of HIV. But as important as reflection is tonight, and the annual commemoration of World AIDS Day, it's more than just silent contemplation. It's about reminding ourselves that HIV hasn't gone away. I was walking through the city centre yesterday and today. I hardly saw anybody wearing a red ribbon. Plenty of people wearing them here, but people don't seem to wear red ribbons anymore. Many of you will know it's now 30 years since HIV was first identified, and Terence Higgins was one of the first people in the UK to die of AIDS, which led to the charity the Terence Higgins Trust. At that time, the virus was thought to only affect gay and bisexual men, and many of you will remember it was called GRID, which stood for Gay-Related Immune Deficiency. We know it's very different now. Over the past 30 years, though, we've seen huge developments in our understanding of the HIV virus. We've got improved testing, we have increased effective treatment and care for people living with HIV. And in the UK, I'm really proud to say that we've got legislation which is designed to protect people living with HIV from discrimination. But what really saddens me is that the knowledge amongst people of HIV and the stigma continues. There's a lack of awareness around HIV, and there's a continued stigmatisation of people living with the virus. Those of us who were around during the era when HIV was first identified will remember the iconic images which punctuated that timeline to the present day. In 1986, the government launched a campaign with the slogan, "Don't die of ignorance," which was supported by a television advert with the AIDS, "Don't die of ignorance" engraved onto a tombstone. Millions of leaflets were posted through people's letterboxes. Every household in the country was aware of HIV and AIDS. In the 1980s, we also saw Princess Diana opening the first specialist HIV ward in the UK hospital, and she was famously photographed shaking hands with somebody living with HIV. We can be cynical about that, but many people think that that was a turning point in terms of people recognising that actually you can't catch HIV from shaking hands with somebody. We then saw the emergence of the red ribbon as a symbol of HIV awareness, and we saw other markers during those periods. The rock star, many of you remember Freddie Mercury, who announced he had AIDS the day before he died. We also saw EastEnders, a popular soap opera, running a story about Mark Fowler discovering that he had HIV. 30 years ago, there were more messages about HIV, and those messages were simple. Catch HIV, get AIDS, and you die. Nowadays, the picture is much more complex and nuanced. With early detection and adherence to appropriate treatment, the outlook for most people is relatively good. However, HIV can still have serious medical and psychological impacts on people, particularly if the diagnosis is late. Sadly, in the UK, over 500 people still die, predominantly because of late diagnosis. Many of these could have been prevented. We shouldn't underestimate, though, the impact that stigma has and the pressures of living with HIV have on people's physical and mental health. Sadly, stigma prevents people from taking HIV tests, in spite of all our efforts to encourage earlier testing. But we cannot glibly promote testing without understanding that not only lack of awareness, but also stigma is an obstacle to people testing for HIV. I heard a doctor on the radio this morning, many of you will have heard it, and he described HIV being like diabetes. I'm sorry, I disagree. Most people I speak to do not feel that living with HIV equates to living with diabetes, and the discrimination and rejection they experience. Half of people living with HIV who were questioned recently in a survey said that they feel guilty or ashamed of being HIV positive. And nearly a quarter of them said that they've been verbally assaulted, harassed, or threatened in the last year. I don't think comparisons to other illnesses, though well-intentioned, are helpful. There's a recent study in the House of Lords which suggested that during the 1980s, with the campaigns, 98% of the public were aware of HIV and how it was transmitted. Compare that to recent research undertaken by the National AIDS Trust, which found that 1 in 5 people, 1 in 5, did not know that HIV is transmitted through sex without a condom. And surveys around young people's awareness of sexual health are abysmal. 16 to 24-year-olds have little knowledge about how HIV is acquired. There was a survey undertaken by the BBC only a few years ago that showed many young people believe that HIV could be caught from kissing and from toilet seats. 90% of them, in the same research, admitted that they never or rarely think about HIV when making decisions about their sex lives. I gave a talk in Barnes this afternoon to some 17-year-olds. When I asked them how much sex education they'd had, most of them said little or none. And the ones that had had any education said it was all from videos. I think that's appalling. It's estimated that next year up to 100,000 people will be living with HIV in the UK, and almost a quarter of those people will not know that they have the virus. The combination of deteriorating levels of HIV awareness and sustained levels of stigma are creating a perfect storm, both preventing people from HIV testing and making the lives of those living with HIV not only more difficult, but more secretive. If we've learned only one thing in the past 30 years, surely it has to be that prevention works and that it is cost effective, both in human costs and in monetary costs. We need national awareness programs which have the potential to inform, to educate and to protect. But campaigns alone are not enough. Young people need to be educated, both at home and at school, about HIV. And that process has to be supported by easy access to testing, treatment and condoms. It is not enough to deny our young people sex education. Initiatives need to be established which challenge HIV stigma, again in our schools and in our communities. Prevention messages and anti-stigma strategies have to run in parallel. The two are linked, and unless we accept that fact, we'll continue to see high levels of HIV increase year on year. My hope for next year is that at least here in Sheffield we can see more levels of awareness, local campaigns, and more challenges towards ignorance and stigma. And hopefully we'll see more people wearing red ribbons and demonstrating their awareness. I certainly look forward to seeing more people in Sheffield wearing the red ribbon. And I look forward to us taking that message out there, that we have to challenge stigma and we have to stand up for the rights of people living with HIV. Thank you.
Thank you very much, Steve. Our next speaker is Eve Joseph, who's a sexual health support worker in the city, and she'll be speaking about a very important issue, Sheffield's African Sexual Health Peer Education Team, which is made up of volunteers who do a range of work with community groups on sexual health issues.
Thank you and good evening. I'm going to talk a little bit about HIV within African communities as well. HIV and AIDS are having a widespread impact on many parts of African society. The effect of life expectancy. AIDS has erased decades of progress made in extending life expectancy. With sub-Saharan Africa more highly affected by HIV and AIDS than any other region in the world, an estimated 22.5 million people are living with HIV in the region, around 2/3 of the global total. In 2009 alone, around 1.3 million people died from AIDS in sub-Saharan Africa, and 1.8 million people became infected with HIV. Average life expectancy in sub-Saharan Africa is now 52 years, and in most heavily affected countries in the region, life expectancy is below 51 years. The effect of AIDS epidemic on households can be very severe. especially when families lose their income earners. In other cases, people have to provide home-based care for sick relatives, reducing their capacity to earn money for their family. Many of those dying from AIDS have surviving partners who are themselves infected and in need of care. Since the beginning of the epidemic, 14.8 million children have lost one or both parents to HIV and AIDS. The social and economic consequences of AIDS epidemic are widely felt, not only in the health sector, but also in education, industry, agriculture, transport, human resources, and the economy in general. The AIDS epidemic in sub-Saharan Africa continues to devastate communities, rolling back decades of development progress. Sub-Saharan Africa faces a triple challenge: providing healthcare, antiretroviral treatment, and support to a growing population of people with HIV-related illnesses, reducing the annual toll of new HIV infections by enabling individuals to protect themselves and others, and coping with the impact of millions of AIDS deaths on orphans and other survivors, community and national development. For most Africans living with HIV, antiretrovirals are still not available. Less than 4 in 10 of those in need of treatment are receiving it. Millions are not even receiving treatment for infections which affect individuals whose immune system has been weakened by HIV infection. These facts reflect the world's continuing failure, despite the progress of recent years, to mount a response that matches the scale and severity of the AIDS epidemic. Whilst here in the UK, you would think things within the African community would be different, yet HIV-related stigma and discrimination remains an enormous barrier to the fight against AIDS. Fear of discrimination often prevents people from getting tested, seeking treatment, and admitting their HIV status publicly. Perseverance in continuing to educate these communities to combat the ignorance that causes people to discriminate, the fear and the prejudice that lies at the core of HIV and AIDS discrimination needs to be tackled at both community and national level. The African Peer Educator Project, with the support from the Centre for HIV and Sexual Health, are continuously involved in a lot of outreach prevention interventions in order to support African communities living in Sheffield. People living in the UK are privileged to have medication and support which is offered free of charge. For anyone to make change, you need to have correct information, and that's one of the things we do within the African Peer Educator Project. People's skills is a crucial part of our work. If we don't blow our own trumpets, nobody will. The African Peer Educator Project will be hosting its 6th annual Break the Silence event commemorating World AIDS Day with African communities on Saturday the 3rd of December from 1:30 to 4 p.m. at the Vestry Hall in Burngreve. Please come along and support. And I'd just like to leave us with just a couple of thoughts or questions that we can think of within the work that we continue to do. And it's, how can our mindset change the way we think? How do we address issues around changing people with sticky thinking? Thank you.